Hello, everyone. Welcome today to today's webinar that's brought to you by Active Aging in Manitoba and the Wellness Institute. My name's Karen Whalen, and I'm the host of today's webinar. Today's webinar is going to be facilitated by Sonal Purohit. She's a pharmacist, and she's also the business owner of two Shoppers Drug Marts, one here in Winnipeg and Sage Creek, and then also up in Thompson. So she gets to move around a little bit. She's also an instructor at the College of Pharmacy at U of M, an instructor and pharmacy consultant for Robertson College for the pharmacy technician program. And to add to that, she's also a counselor at the College of Pharmacists of Manitoba, as well as a board member of the Canadian Mental Health Association in Toronto. So she comes to us with a wealth of experience and knowledge. So we're thrilled that she's joining us today to talk to us about the protecting ourselves and getting the flu shot, which is more important than ever right now. I'll just move my slide. Here you have the Wellness Institute, a photo of the Wellness Institute, and this is where both Active Aging in Manitoba, or AIM as we refer to ourselves, where we're housed. We're housed right in the Wellness Institute. It's in the North Quadrant in the city of Winnipeg. The Wellness Institute is a not-for-profit lifestyle medicine arm of Seven Oaks Hospital. So we're connected to the hospital, but we're financially independent from the hospital. And really our goal is helping people optimize their well-being wherever they are along the continuum. AIM, housed at the Wellness as well, aligns itself very closely to the mission and the message of the Wellness Institute. However, AIM is dedicated to promoting healthy active aging for all older adults, specifically in all of Manitoba. And our objective is to, our goals and mission is to enhance the older adults' health, their mobility, and help them continue participation and engagement in their communities, which is really challenging right now during these times. As I'm sure all of you would agree with me, there's never been a more important time to be healthy. If complications of COVID are definitely more challenging when individuals and likely to develop in individuals with underlying health conditions. So now is a time when implementing positive lifestyle changes and engaging in positive lifestyle activities is really, really important. And prevention is really the key, which is what we're here to speak to you today about, is prevention and prevention of the flu with getting a flu shot and how important that really is. So Sonal is going to talk to us today about that issue. And when you're listening to this webinar today, if you have any questions, there's a chat box on the right-hand side of your computer. Please feel free to address any of your questions in that chat box, type them out, and we'll address them at the end of the webinar, just because we want to keep with the flow of the webinar and not have and not be interrupted throughout the webinar. So we haven't forgotten about you. If we don't attend to your questions right away, we're just leaving them right for the end. So without further notice now, I will pass things over to Sonal.
Hi, good morning, Karen, and good morning to all the listeners of the webinar today. My name is Sonal Purohit, and I am honored and privileged to be here today to provide you the information and knowledge about a very important topic that the Wellness Institute and the Healthy Active Aging of Manitoba has invited me to present to you today. And that is on the topic of the flu or influenza and the importance of getting the vaccine to help prevent the flu. So the ball is in our court. And what I mean by that is, from my perspective as a healthcare professional, it's my responsibility as the pharmacist, as the frontline healthcare provider, to provide my patients with the information and knowledge that they require to make an autonomous decision about their best health outcome and their healthcare needs. And for you, the patient, it's important that you empower yourself with education. You need to do your homework to learn the facts so that you can make the decision with your healthcare provider to get the best possible health outcome for your healthcare needs. So the primary objective of today's lesson will be on the influenza. If time permits, I may touch on pneumonia. And there are some slides which do talk a little bit about the complications of influenza, in which one of them is pneumonia. But the primary focus today will be on the flu for today's webinar. So just going to the previous slide, Karen, I just wanted to maybe highlight an important fact regarding where we stand with statistics in terms of how well Canadians, specifically those over the age of 65, get their flu shot. And we're sitting well below that target of 80%. And healthcare professionals are affiliates from the government side. They're not really sure as to why we're not reaching that target of 80%. And that could be for various reasons. Just on the previous slide there, Karen. So one of them could be, thank you, that there may be a lack of awareness of influenza and or the pneumococcal disease. Number two, there may be a lack of recognition of the importance of getting the adult immunization done. Number three, there may be a lack of the healthcare provider's knowledge about adult immunization and recommended vaccines. And there may also be a lack of understanding of vaccine safety and efficacy. And last but not least, there could be a lack of publicly funded vaccine and reimbursement to vaccine providers, which could be participating to us not reaching our goal of that target of 80%. Influenza is amongst the 10 leading causes of death in the world, along with ischemic heart disease, stroke, and chronic obstructive pulmonary disease. So that is why there is such a big focus on influenza globally. So let's dive right into our discussion today on influenza. And here I'm going to be talking briefly about the stats which are reported annually after the influenza season in Canada. So we can see here that after the annual influenza season, the Canadian stats have reported 175,000 ER visits, about 12,000 hospital admissions, and about 3,500 deaths. As well, interestingly enough, of all those individuals who are hospitalized, as well even those who have experienced death with the flu, the large proportion of these individuals are from our individuals who are over the age of 65. So if you tap on that, Karen, I'll give you a magic number here. Yes, of 70%. So 70% of all hospital admissions are over the age of 65. And if you look at death, 91%. So these are big numbers. Influenza in older adults is a highly contagious respiratory infection. And the transmission of this virus can occur both directly as well as indirectly. Directly, the transmission occurs mainly by droplets made when somebody with the flu will cough or sneeze. As well, believe it or not, if somebody's doing any heavy breathing, such as during exercise or even talking loudly or singing, these droplets can be easily transmitted to individuals who are in nearby vicinity. And these droplets can spread to others up to 6 feet away. So, over the past 8 to 9 months, our healthcare officials have been, really stressing, following the fundamentals of that physical distancing. And this is one of the reasons why. Also very important, if somebody does sneeze or cough, that they do so in the sleeve of their arm so that these droplets do not travel the distance to infect other people around them. And indirectly, the viruses can survive on surfaces as well for about 24 to 48 hours. So again, any surfaces that are commonly touched amongst other people, such as door handles, laptops, light switches, telephones, it's important that we, sanitize these areas with antibacterial agents to help kill the bacteria and viruses on these surfaces. And I just want to make a note here that if you're going to use any disinfecting agents, we really want to make sure that they contain at least 60% of alcohol. So they're going to be vigilant enough to kill any type of virus or bacteria on these surfaces. Older adults can be at increased risk of exposure also due to the fact that they may live in close living quarters. So a lot of individuals in this age category may live or reside in places that are 55+ complexes or long-term care facilities. And these living quarters, not only do people live in close proximity and share common areas, but they also share the caregivers in these facilities as well. And right now, we are seeing a spike in our COVID cases in the long-term care facilities, and one of the reasons being is that these individuals in these facilities live in closed, confined areas, and they share the common caregivers in these facilities. So these individuals are not going out, but people coming in are putting these people at risk. So we really have to be mindful of that. Another factor I wanted to touch on is the concept of immunosense. Older adults are more susceptible to the flu because of immunosense. And what I mean by that is immunosense is a natural and progressive weakening of the immune system with the aging process. And as this happens, this will result in higher incidence as well as severity of infectious diseases, including the flu. And in addition, it will lower the strength and persistence of antibody responses to vaccines. So a lot of contributing factors to how the flu virus can spread, to who may be at risk and why. And with our natural, physiological changes as we start to age, also puts people over the age of 65 at risk of getting the flu. All right, so a very common question that I've been getting at the pharmacy is, do I have the cold? Do I have the flu? And most recently, do you think I have COVID-19? So they will list all of the symptoms that they're experiencing, and it's for me to decipher or try to decipher what they may possibly have. And as you can see from this chart, the symptoms related to the cold and the flu are very similar. However, with the flu, what I've written here in yellow, the symptoms are a little bit more predominant. As well, the symptoms will come on a lot more abruptly rather than with the cold. With the cold, these symptoms are very gradual and may take days for them to actually experience. So that's a big difference. And another big difference is the potential complications that could arise from these conditions. So with the cold, individuals may experience or may get sinus congestion or perhaps even an ear infection. But with the flu, potential complications include pneumonia, worsening of underlying medical conditions, and both of which could be very life-threatening. So with the flu, it's a lot more serious than with the cold, which is typically self-limiting for most individuals. All right, so this is very interesting, is in terms of the clinical symptomatic presentations of individuals who are above the age of 65. So older adults may present themselves with different symptoms of the flu than individuals who are younger. So the different color of bars represent the three different age categories. So those in their 60s, 70s, and 80s. So we can see with the symptom of cough, individuals in all three categories pretty much will experience cough associated with flu. However, symptoms of fever, shortness of breath, runny nose, even feeling malaise or muscle ache starts to decline as age increases. But interestingly, when we look at mental status, or if we're going to evaluate somebody's cognitive ability, it starts to increase with age. So it's very important for, as a healthcare provider, as well as a caregiver or a family member, to be aware of somebody's cognitive ability. Are they able to answer the questions that they normally would be able to answer? Are they confused, which they normally wouldn't be at this specific time? And that could be that they may be experiencing symptoms or of the influenza or are having the flu. So we really have to be mindful of this clinical symptom that many people are not aware of. All right, so hospitalization and mortality occurs disproportionately in adults over the age of 65. So while Canadian adults age 65 plus represent only about 15% of the Canadian population, they account for about 70% of all hospitalizations due to the flu and 91% of deaths due to the flu. So again, big numbers. All right, so the outcomes of influenza are serious in our older age populations, and what I should really say is people over the age of 65. Okay. One thing we need to consider in addition to age is underlying medical conditions. So 53% of Canadians who are age 65 and older have 1, 2, perhaps even 3 underlying medical conditions, which may be cancer, COPD, diabetes, heart disease, obesity. And the presence of underlying comorbid condition further increases the risk of death from influenza, in addition to being the age of 65 and older. So now we're compounding the risk of age along with having underlying medical conditions, which increases our risk of both complications due to the flu as well as even mortality. All right, so influenza causes both direct as well as indirect complications. So directly, influenza will affect the respiratory system, and this can cause exacerbations of asthma, COPD. It can also lead to infections of the ear and sinus cavity. And as I mentioned earlier, it can also lead to bronchitis and pneumonia. Indirectly, influenza may be a trigger for acute myocardial infarction or heart attack. It can also be a trigger for ischemic heart disease or angina, or even a cerebrovascular disease such as a stroke. So again, very, very, life-threatening conditions. And influenza can also exacerbate conditions such as diabetes, as well as kidney disorders or kidney dysfunction in an individual. One interesting study that was published in the New England Journal of Medicine had to do with influenza and a heart attack. And they looked at individuals who were age 65 and older and who experienced a heart attack after having the flu 7 days later. And when they looked at this study, that they found that the incidence of an acute myocardial infarction, which is a heart attack, is 6 times higher 7 days post-influenza in this population of individuals who are over the age of 65 with having a pre-existing heart disease as well as having no previous heart disease. So again, a very serious point I really want to make across is somebody doesn't have to have a pre-existing or underlying heart disease for them to fall into having a heart attack after experiencing the flu, because the flu puts a big stress on the cardiovascular system. So age itself will, as we know, compromises our physiological health as well as our immune system, and puts you at risk right away without having any underlying medical condition. The heart and lung disease increase the risk of influenza-attributed death. So for Canadians aged 65 and older admitted to hospital with a respiratory complication, the risk for influenza-attributed death was 5 times greater amongst those with chronic heart disease, 12 times greater amongst those with chronic lung disease, and in fact 20 times greater amongst those who had both a chronic heart condition as well as a chronic lung condition. So again, very alarming statistical numbers. So we can definitely, hopefully, you can appreciate the importance of getting the flu shot, and why being 65 years of age alone is a risk factor, and you compound age along with underlying medical conditions puts you at even greater risk. So getting vaccinated is important. Which vaccines we should use really depends on what's available and what discussions you will have with a healthcare provider. One important slide I want to talk about right now is the fact that influenza vaccines, even though they're amongst the most effective means to prevent influenza, they are generally less effective in adults over the age of 65. So you can see in this chart that there is a gap in the effectiveness when an individual who is over age 65 versus an individual who is younger than the age of 65. And this gap in the vaccine effectiveness exists primarily to that concept of the immunosense, which I talked about at the beginning of the presentation, that our immune response and our immune system definitely starts to decline naturally as we start to age. So some individuals have asked me, I'm 70 years old. I've been reading that the vaccine may not be as effective for me because of my age. Should I still get vaccinated? And absolutely you should. And the next slide is going to reflect that information. So, the 2 slides over. But again, I just wanted to have this slide here to reflect that we are below that 80% target of getting our individuals who are over the age of 65 vaccinated. So that is our target, but as you can see from this graphical representation over the past few years, we are hovering over the mid 60s to 70s of those of people actually getting vaccinated. All right, so yes, it is very important to get the influenza vaccine, despite the fact that there is a gap in that in the vaccine effectiveness between individuals who are over the age of 65 versus those who are younger. And this is because vaccination is associated with reduced severity of influenza infections. So even in patients who have been hospitalized with the flu, the vaccination has been linked to less severe outcomes. And studies reflected that among adults over the age of 65 hospitalized with lab-confirmed influenza, patients who were vaccinated against influenza had a 61% lower odds of in-hospital death, as well as a 37% lower odds of an ICU admission. And furthermore, these individuals had a 34% shorter intensive care unit length of stay, as well as 24% shorter hospital length of stay. So again, please get the flu shot despite the fact that you are over the age of 65, despite the fact that your immune system response to the flu shot will be weaker than somebody who's younger. The benefits are definitely there for you to get the flu shot. I wanted to bring to your attention also that the influenza vaccine lowers the risk of major cause-specific mortality, another big reason to get the flu shot. So for example, let's look at diabetes, because a lot of the population do have diabetes as one of the chronic underlying medical conditions. So individuals who are diabetic and they got their flu shot, they experienced a 55% reduction in mortality risk compared to individuals in that same age category who did not get the flu shot. So again, big benefits for getting the flu shot in terms of reducing your mortality from underlying medical conditions that you may have. All right, so the influenza vaccine recommendations in Canada. Again, it's very important as a patient that you empower yourself with knowledge, have the discussions with your healthcare provider to determine which vaccine is the best for you. And currently in Canada, there are 4 different influenza vaccine options which are available. So this is one of the reasons why you should empower yourself with knowledge to determine which vaccine you should get to make that informed, autonomous decision regarding the flu. I want to stress and highlight one of these 4 influenza vaccines, and that is our Fluzone, or the high-dose flu vaccine. And this is because, according to NACI and clinical studies that have been done with this high-dose flu vaccine, the studies have reflected big benefit with individuals who are over the age of 65 with using this vaccine. So the high-dose flu vaccine consistently demonstrates higher and/or superior immune responses compared to our standard dose influenza vaccine. And you may ask, how does this vaccine do that? Well, very simply. The high-dose influenza vaccine contains 4 times the antigen, or produces 4 times the antibodies for you, that this will result in it being 24% more efficacious than the standard influenza vaccine in protecting you against the flu. So again, 4 times the antibodies. That is very important to be aware of. All right, so in addition to how well we can evaluate this high-dose flu vaccine, this high-dose influenza vaccine has also demonstrated to be effective in decreasing hospitalizations and other serious events compared to getting the standard dose influenza vaccine. So we can see that with all-cause hospitalizations, serious cardio or respiratory conditions, as well as even pneumonia events, are a lot less with individuals who have received the high-dose flu vaccine compared to individuals who received the standard dose influenza vaccine. So big benefits for these individuals. Side effects, again, a very important question for me to address and for you to ask about to your pharmacist or healthcare provider. When we're comparing the standard dose influenza vaccine and the high-dose flu vaccine, you may think, oh, it's 4 times more potent, it has 4 times the antibodies, it's going to have more side effects. Not so. Your typical side effects are going to be relatively the same, if not the same, as your standard dose flu vaccine. So you may get some, discomfort in the injection site of the arm, some redness, perhaps even a low-grade fever or malaise for the next 24 to 48 hours. But in terms of any unusual side effects or side effects that are different from getting the standard dose flu vaccine, I haven't come across that, none which have been reported. All right, so where can we get this high-dose flu vaccine? Well, the high-dose flu vaccine has been available in Canada for quite a few years now, but there is a lot of unknown about this vaccine, and that's why it hasn't been delivered to as many people that I would like to see get it. And it has to do with so many different factors. So number 1 would be availability. Number 2, accessibility. In Manitoba, you do require a prescription from your healthcare provider, whether it's a nurse practitioner or a physician, before you can obtain the high-dose flu vaccine from your pharmacist, as well as cost. The high-dose flu vaccine is not a publicly funded vaccine in all provinces. So right now, only Ontario, as far as I'm aware, is the only province where all adults over the age of 65 can receive the high-dose flu vaccine as a publicly funded vaccine. In Manitoba, for this year, they have extrapolated the coverage to different individuals meeting the criteria. But all individuals over the age of 65 who reside in a long-term care facility or are in transition to a long-term care facility or are residing north of the 53rd parallel are all eligible to get the high-dose flu vaccine as a publicly funded vaccine. Okay? So there is no reason why, as a Manitoban, you cannot receive this vaccine, but the challenges is you need a prescription, and there will be a cost for this vaccine to you at the moment until it becomes publicly funded. All right, so I guess, Karen, I'll turn the presentation on to you now.
Yeah, I'm just fielding some questions here from some of our listeners. And one of them is with regards to the high-dose flu vaccine. And the question is, if I get the high-dose flu shot, do I still need to get the flu shot next year?
Okay, well, that's a great question. The influenza vaccine, whether it's the standard dose or the high dose influenza vaccine, you must get it annually. So it doesn't have that immune memory, and because our influenza viral strains change annually, we do need to get the flu vaccine every year.
Okay, thank you. This question is, someone's asking, you mentioned that the immune system is not as strong as I get older. Do you recommend anything I can do to boost that?
Another excellent question. So unfortunately, we can't do much about the natural physiological changes that happen internally. Okay, so as we start to age, there's a lot of physiological changes that start to happen. However, we can, introduce elements of nutrition, exercise, relaxation, good sleep hygiene that does contribute to providing a more robust immune system, but it will not change the physiological aspects of your immune system decreasing as you start to age. But definitely, having, a healthy diet, introducing, exercise on your everyday lifestyle, having good sleep hygiene plays a huge role in your overall health as well as in your immune system. So I definitely would encourage all individuals to try to incorporate that.
Another one of our listeners asked, will this high-dose flu vaccine protect me also from COVID-19?
Okay, another good question. Unfortunately, not. The high-dose flu vaccine will only protect you against the influenza virus, but not against the COVID virus that's currently out there. But there is a vaccine coming out very soon for that.
That's good news.
Yes.
Thanks. Here we have another question. This person indicates that they're 70 years of age and they have both heart disease and diabetes, and that they're planning on getting the high-dose flu vaccine. If their spouse, he says, if my spouse does not have any medical conditions, should he also get the high-dose flu vaccine to help further protect me?
Absolutely, without hesitation. So again, if anybody has an underlying medical condition, it's going to only increase your risk of complications from influenza. But age alone, 65 plus, is the only criteria that you would need for me to recommend the high-dose flu vaccine to you.
Okay, and I think we have time for one more, and it's just, when is the best time to get the flu shot? Is it ever too late?
Okay, again, another very important question, and especially because of what's going on this year. I know pharmacies, clinics, we all ordered the flu vaccine, but the vaccines were distributed at different times. We all didn't get the orders that we did place earlier in the fall season. So yes, to this day, not everybody who should get the flu shot has received their flu shot, but it's never too late to get the flu vaccine. People get it, into January and February as well. So if you haven't been able to get the flu shot because of accessibility to it, I know Manitoba Health is still rolling them out. So please check with your pharmacy or your family doctor and make sure you do get that.
Thanks very much. Thank you very much to Sonal for this most informative and interesting presentation. We hope that all of you learned something new. I know I did, and have enjoyed it. We will be sending all of you as registrants the recorded link so you can listen to it again if you'd like, or maybe perhaps you want to share it with a friend. It will be uploaded onto both the Active Aging in Manitoba website and the Wellness Institute website. It will be archived under the webinar library section, so you can find it there too. But in a few days, you will receive the link, so you can watch it again, or pass on the knowledge that you learned today and help out a friend or a family member. Again, thank you so much for joining us, and we hope that you all stay well and stay healthy. And thanks again for letting us be part of your morning here today. Thanks, and thanks again to Sonal too for taking time out of her busy schedule as well. So on behalf of Active Aging in Manitoba and the Wellness Institute, thanks so much. And again, stay well.